Now, for the next possible cause of hypertension that we'll be looking at is environmental stress and smoking. Okay, so I just said, oh, let me just discuss the two of them together. Okay, environmental health and smoking. How can they be able to cause hypertension? So, environmental health and smoking is as follows. So both of them they raise blood pressures. Okay, if you are stressed, um, it overactivates your stress system. So the sympathetic nervous system in particularly is overfunctioning, and this could make a lot of hormones to go up, to skyrocket. So let's look at the environmental health first. So environmental health basically activates your sympathetic nervous system. It makes your sympathetic nervous system to what shoot up. So stress could be noise, could be pollution, could be overcrowding, could be stress from your job. So it triggers the flight or fight, responses. The sympathetic nervous system is activated so much. So it releases a lot of adrenaline and noradrenaline. So those hormones will increase heart rate and constrict the blood vessels. This will raise the blood pressure. Okay. They'll have hormonal effects. So chronic stress will elevate cortisols normally. This will promote sodium retention and weight gain and vascular stiffness. So also inflammation and oxidative stresses. Environmental pollutants and psychosocial stress contributes to endothelial dysfunction. This will reduce the ability of blood vessels to relax. Then lifestyle impact. Stress often leads to unhealthy coping behaviors. You're not eating well, you are smoking to run away from depression, you are taking alcohol. This could possibly have a side effect which will cause you hypertension. And also smoking and hypertension now. If you're smoking, just know that what your blood pressures are rising, like, okay, it causes a temporary spike in blood pressure due to nicotine induced sympathetic stimulation. Okay, but with continuous smoking, it starts becoming permanent. So endothelial damage, smoking gives a lot of nitric oxide production, and this will actually damage your blood vessel linings. It will make your arteries less flexible, to make them stiffer. So atherosclerosis acceleration is tobacco toxins will promote plaque buildup in arteries. So inflammation and thrombosis, smoking increases inflammatory markers and clotting risk. So long-term effect, persistent smoking leads to chronic hypertension and greatly increases the risk of heart attack, stroke, and also kidney disease. So this is what we have for how this environmental stress, could lead to hypertension.